Right. No, you bring up a good point. And when I think about that business to-do list, like I look at it like kind of like exercising. You know, it's one of those things, yeah, you can be super self-motivated to do it, but I always think about how can you get what I would call, I guess, an accountability partner, right? Like
Hmm.
if you're the owner, I know you can consult your CPA and you can talk to,
Yep.
if you have a partner or business partner on that, but do you think that establishing some person that's going to hold you really accountable to how much of your list have you got done? Have you done
Yep.
these things?
Yep.
I just think is something that, I haven't heard a lot of people talking about, but I think is
Yeah.
something that could be really beneficial.
Yeah, I think if you're a CEO of a major corporation, you have a board of directors, right? They're
Right.
going to pay attention to you. Or if you're in a if you're in a big DSO, you certainly have executive team people who are kind of keeping watch.
Right.
But when it's you're the show and it stops with you,
Yeah.
if you have some people have a great management or administrative lead that really does hold them accountable, holds their boss accountable in some respects. But
Right.
largely that is lacking in a lot of small businesses, not just a dental practice. And where I think people do benefit is having that, whether it's whether you call it a mentor, a coach, an
Yeah.
advisor, a trusted friend. I'm lucky that I have a dad who was a CFO for a number of years, so I call him up and he tells me when I'm sounding like a genius or when I'm full of crap. Either
Right.
way, I
Right.
get I think I get an honest, slightly biased to my favorite answer, but he kind of holds me to task. So I have the benefit. I have somebody that I trust that happens to be my dad that I use for a
Yeah.
lot of conversations. But um, I work with several clients, even in activities where I'm focused maybe more on acquisitions, that they still have somebody who come in, on strategic stuff that's more in their wheelhouse, or it's just that, people, could use a once a week checkup, an hour a week or an hour every 2 weeks, just to hold
Yeah.
them to what are the tasks. And I do find that when sometimes I work with clients for me, it's like going to a therapist. Like I'm just sitting there having a conversation of, did you do this? Did you do that?
Right.
And you're helping them reshuffle because priorities do shift. And I do
Yeah.
think that, everyone benefits from having a voice outside of the business, give you a little insight. Sometimes some people have to pay for that advice because they don't have the right contacts. Other
Right.
people might have a colleague or peer that can help them all the time.
Right.
Yeah.
Right. So this whole idea, right, of around dates, right? Like in every city, there's different dates, and you have different people that are in relative positions of power that are making the determination by this date this is going to open. How do you think an owner should think about that date? Like, what should be the expectation of that day one, and how important do you think doing things specifically for that date or on that date is? I'm just trying to uncover just a little bit more about the psychology of the dates, because the date could get moved. And what does that mean? And should you just have your own internal dates regardless, outside of things, of course, you can do legally?
Yeah, I would think so. I mean, I think if you're told in your state that the world's opening up on May 15th, it might be a challenge to schedule patients for a day that could be a moving target, or you have patients who are willing to move. And then the next question is, how many patients need to walk in the door or go into immediately anyway? So
Right.
if you're thinking about anything to improve your practice right now, which might be physical right now, right? It's because you certainly need to be thinking about patient flow and dynamics. And
Yeah.
I don't want to turn this into, be another, and there's plenty of people who are more expert than I am in terms of office reconfiguration and equipment needs. So I don't want to play that role. But if you're not getting that advice or input right now, then there's certainly people I could direct people to that have already made modifications or working through them right now to be as compliant as possible. And I think it goes not just from patient care and safety and staff care and safety, but I do think it leads into how you're going to market your business going forward, because it's not enough to open the door.
Right.
It's enough to tell patients. It's enough to welcome patients in and make people feel comfortable. And even if you're doing the same thing as the guy down the street,
Right.
If you're presenting that in a way that it's resonating with people, you're going to feel like the safer alternative is somebody, or the better alternative. And I think that's so, marketing and thinking about what you're offering or how you're presenting it is going to be critical.
Yeah. Yeah. Do you think, just speaking of marketing, specifically, how do you see the messaging that needs to be different? Let's just start internally, right? Because you're also marketing directly to your team and your staff, right?
Yeah.
do you see a difference between the front end and back end of the office in terms of how you need to tell them about how they should be prepared, kind of, post COVID, and then the marketing that's done just to dentists in general, so that they can kind of, feel good about what's going back, which is separate from marketing to the patient, right?
Yeah, no, and I think it's a great point because, starting my healthcare career in the surgery center space, we certainly were very much more focused on infection control
Right.
And safety matters. Now, I think even in that space, you still have to up your game.
Yeah.
But I think when you go to the traditional medical and dental practices, this is people get the concept, but it is a bit of a new reality, and to think a little differently. And I think when you're talking about something like this, you don't want to, as much as the back, the DAs and the staff in the back are certainly dealing with more face-to-face interaction. I think just as much the front staff have to feel at ease. They're the first people to come into contact and to manage a patient through.
Right.
So I think everyone needs to feel like they're part of the. I think everyone needs to feel like they're part of the solution and being
Right.
informed. Right. I think the worst thing you can do as a manager or an owner is to say we're doing something and not give people context as to why, or not let them have a voice, because those people are going to have input as well that would be particularly valuable. What if we did this or that? Right? The people who are day to day doing know their jobs better than you do.
Yeah.
Let them, if they have a voice in how things can feel safer, they're going to feel a lot more productive and a lot happier walking back into the office as well.
Right. Right. So what do you think kind of is the level of disclosure, I guess, that needs to happen, right? Like the big talk is on, like, privacy is probably going to go out the window as we know it, in terms of, what you're allowed, and that could even have implications just in terms of to your own privacy and health records that would be shared now that normally wouldn't. But just in terms of, what you're letting people know, like, is it kind of, when you go to a hotel, if God forbid something tragic has happened in that room, like, they're required to tell you. Do you think that's where we'll head in that sense?
Oh, that's a good question. Can we get Brian Kaleo on the line right now? No, can I call a friend?
Right.
That's an interesting question. I think because, the reality is the instant that, did we have a patient that was not well in this room, but we sanitized it? That's an interesting question. I think that people are just going to have a general awareness of the, kind of like there may be this plant, made food that contained peanuts in the factory. I think we saw patients, therefore we may have seen somebody. And, obviously if there was a materially bad situation, I think you'd be wise to close your office and make sure that if you had to shut it down for a day to do a full crazy sanitation, you'd be doing that. You'd be doing a disservice to yourself and the community if you didn't. So I don't know what the standards will be, but I think you're going to have general disclosures because there's just too many incidents that are going to be known or unknown.
It's kind of like the same when you drive into an underground parking lot. You see all the signs of risk that said, known carcinogens because of the carbon monoxide and whatever else is pumped in through the pipes. I mean, and it's interesting when you look at the numbers as you kind of bump in age demographics, it shows almost a 10% jump in the level of uncomfortability. North American did a great study that kind of presented some overall numbers. But
timing is everything. Timing is everything in the survey. So and so I think the fears are real right now, which is why I wouldn't be rushing to necessarily have my door open on day one, because if day one might move, there is a lot of concern today. But in 2 months, how people feel, or a month, people may end up a very different level of adjustment. So